finally getting colder out, the weather's changing, and some people swear they can forecast weather by how bad their joints hurt. Now, can changes in temperature or drops in barometric pressure really impact how our body feels? Before you begin pulling out your raincoat simply because your knee hurts, let's take a look at the data. One study recently looked at the amount of medical office visits on sunny days versus rainy days. The researchers analyzed visits from almost 12 million medical office visits taking place on 2 million rainy days and 9 million dry days, and the findings didn't find any connection between weather and the amount of medical office visits. Another study confirmed these findings and found that there is no relationship between back pain, humidity, rain, temperature, or barometric pressure. If the data does not support the fact that people feel pain in their joints when the weather changes, how did this idea become so widespread? One thought is that people tend to remember when two things happen together. They remember when their knee hurts and it rained at the same time, but they don't really recall the many times that it rained and their knees didn't hurt. This is the same phenomenon that tends to have us linking when we're talking about something and then social media shows us an ad on that exact same thing. We really remember those connections, but we don't remember the hundreds or thousands of ads that we see that had no connection to our lives whatsoever. Now, although science may not agree, many people are convinced that their joints can predict the weather better than a meteorologist. And does this mean that all those people are wrong? I don't think so. Pain is a complicated thing with many different inputs, and it can be hard to draw conclusions on such a complex topic from just a few of these studies. If your joints hurt when the weather changes, you do not need a study telling you otherwise. So besides moving to Florida, what can you do about it? Our joints and muscles thrive on movement. Healthy movement has been shown to increase mobility of joint fluid, leading to overall healthier joints, as well as decreasing inputs from the brain that can lead to pain. So movement is very important. Instead of just thinking that your joints will inevitably hurt when it starts to rain or the weather starts to change, be proactive. Do things that are healthy for your joints. Maybe your joints will still hurt when the weather changes, but they may not hurt as much. Or at the very least, you are doing something very healthy for your joints and good for them in the long term. You never hear a 5-year-old complaining that their knee hurts when the weather changes. It's when we get older, when we stop doing the things that are as good for our joints that we should be doing. So chiropractic adjustments to the joints that are not moving well can be very helpful. Soft tissue work on the muscles around the joints can also be helpful, as well as giving stretches that can help increase mobility, increase joint motion, can be very beneficial. And those are all things that we love to do, that we love to help our patients with here at TruMotion Therapy. So if you're predicting the weather better than a meteorologist, and I have no doubt that you can, we're here for you. We're here to help with those achy and stiff joints as the weather starts to change. So visit us online at TruMotionTherapy.com to learn more or to schedule an appointment.